Hi everyone. So in this video I want to have a closer look at what is known as the syndrome. So this is a combination of any biological program that is in the healing phase plus an active abandonment, existence, isolation, hospitalization conflict. This is a conflict that impacts the kidney collecting tubules where cell proliferation occurs to prevent fluid from being eliminated from the body. This increases inflammation, which is centered around areas that are in healing, both on the organ and the brain level. The related conflict is an existence, hospitalization, isolation, abandonment, refugee conflict. It is basically experienced as feeling like a fish out of water. So, to explain the conflict and the purpose for the program, think of how a fish would feel if it was left at the shore when the tide went back out. It would feel abandoned, it would feel isolated, it would feel like it's not where it belongs, but maybe like a refugee. It would feel like its existence was threatened. So this gives you a sense of the theme of the conflict. In these circumstances, the survival mechanism would be to prevent the fish from drying out. So, cell proliferation occurs in the kidney collecting tubules to prevent fluid from leaving the body. And the greater the conflict, the more tubules this will impact. This demonstrates how beautifully GNM science follows evolutionary logic and shows how we are connected to the development of all life. The syndrome is crucial to address as it can really worsen symptoms and conditions due to the increased inflammation, and as this will increase the existence conflict, it can create a negative spiral. When you think of it, it's very common for, say, the elderly to go downhill quickly when they're put into nursing homes. And also when people are hospitalised, sometimes they will worsen rapidly. And this syndrome explains why perfectly. It can occur at any phase in a biological program, but you'll mostly find it in healing because that is where we experience symptoms, and so we're therefore more likely to receive a diagnosis and therefore have a diagnosis shock, be hospitalized, or feel our existence is threatened because we're afraid of our symptoms. But it can also be a conflict in itself, and an active abandonment conflict is a cause of obesity according to GNM. Continued inflammation will make any symptoms that are experienced feel worse, such as increased pain, increased stiffness, for example. And this explains why obese people appear to suffer worse symptoms and conditions than those who are normal weight. So rather than obesity being a risk factor of disease, we can now look at this differently, as it is actually the increased inflammation caused by the syndrome that causes symptoms to appear worse, and therefore more noticeable and more likely to be detected or require treatment. So even the smaller DHSs that we may experience and not do anything about, as they are minor, or we may not even notice, can appear worse and more noticeable in obese people with an active abandonment conflict. The increased inflammation causes things like bronchitis to turn into pneumonia, arthritis can turn into gout, encapsulated tumours that have been there for a long time and are just dormant can actually appear to grow because they get surrounded in inflammation. And if they are detected at this stage, they could become incorrectly diagnosed as a cancer. If someone has a more intense biological program, such as a cancer, there needs to be care taken, as the inflammation will also surround the brain lesion where the DHS impacted. This can cause serious complications. At Epicrysis, there can be loss of consciousness as well as severe headaches, and there can even be coma or death. So this is really serious. If someone is in the syndrome, there are certain things to consider. When someone goes into hospital, they are often put on a saline drip as standard. With an active syndrome, this only serves to provide the body with more fluid to use for inflammation, so it will just increase the inflammation. There are also certain medications that will increase inflammation, such as cortisone, chemo and morphine. And ironically, morphine is often given for increased pain that is experienced by the increased inflammation. So there are some things that we can do to help if there is a case with syndrome. Ideally, we would resolve the conflict by finding out what the trigger is. So if it is existence, then providing lots of reassurance, taking the person home or somewhere they're more comfortable with if it's feeling like a refugee, preventing them from feeling isolated or abandoned by making sure they have plenty of visitors. Basically having supportive and caring people who are not fearful and can provide reassurance and courage can really make all the difference. Isotonic baths can also help, as we are, I suppose, in effect taking the fish back home to the sea. For this, I would recommend using Dead Sea salts or Himalayan salts at a ratio of 9 grams per litre of water, which gives a 0.9% salinity. You can use an ice pack on the head at Epicrysis to reduce the inflammation, and this could be life-saving. Diuretics, preferably natural, taken along with sodium bicarbonate, is effective at eliminating excess water. Now, diuretics alone can increase levels of urea, but if you have sodium bicarbonate with it, then that will help to remove the urea too. When the conflict is resolved, the temporary cells are removed with bacteria or fungus, and therefore there may be what is termed as a water infection. There will be lots of urination when the inflammation is released too, and this will likely be cloudy. There will also be high protein in the urine, and if the healing is being carried out by TB bacteria, there will be night sweats. At this phase, if there is night sweats particularly, then an increase in protein intake is really crucial. I would go for 1.2 grams to 1.5 grams of protein per kilogram of body weight at this time. So I hope that helps you to understand the syndrome, and I'll see you next time. Thanks for watching.